Hello, and thank you for joining us for this Facebook Live talking about COVID vaccination. Now, a lot has been said about vaccinations in the care sector, whether or not to have them, and what happens if you don't. I'm Chris Kowalik, and I'm here to ask your questions, and thank you for the questions that have been sent our way before today. Please feel free to post any comments or any further questions to the chat on Facebook alongside this video event that you're watching, and join the conversation with our panel, who are Dr. Charlotte Hart, the GP at Radbrook Green Surgery, Liz Walker, Head of Medicines, Quality and Optimisation at the Clinical Commissioning Group, Ashish Banerjee from Public Health England, Andrew Sizer, Consultant in Reproductive Medicine and Surgery at Shrewsbury and Telford Hospital Trust, and Angie Wallace, the COVID-19 Vaccination Programme Director for Shropshire and Telford and Wrekin. Hello to you all. First question to anybody who wants to answer. Broad question, why have the vaccine? Anybody want to speak?
I'll have a go. Thank you, Chris. I mean, it's a good question. I had my vaccine just a week ago, so I can tell you why I had it. I mean, for me, it's two things really. It gives you peace of mind, and it's our way out of the lockdown. So for me, you know, having had the vaccine, I feel, yeah, I know it takes up to 2 or 3 weeks to work, but I feel like I'm, you know, on the way to being protected. I won't end up in ITU. I won't spread it to others. I won't, you know, if I was a healthcare professional, I'm not spreading it to patients, or if I work in a care home, I'm not spreading it to vulnerable others. So you've got that really good peace of mind. And the other bit is, you know, I am fed up like everyone of lockdown and the restrictions. And I think we know this, if we can all just stick to the rules, get vaccinated, you know, the quicker we'll be out of this, really. So for me, it's those two things.
Now, you said not spreading it to others, but that is one of the arguments that people have been making, in that, why should I have the vaccine? Because it won't stop me from getting it, and it won't stop me from spreading it to others. But then earlier this week, some information that came from Public Health England via the government on some research that says that vaccinations, the first dose, can cut transmission by up to half. That's
right. I mean, we've always thought that it will have some impact on transmission, but we've never been sure about how effective it is. And we're still, I think it's an emerging area of evidence, so we're still not sure that, you know, having the vaccine actually makes, you know, stops you spreading the disease. I'm sure it stops you spreading more than not having the vaccine. But I think there's something wider, you know, people shouldn't wait for the perfect vaccine. There is no such thing. You know, we will get new variants come along. We will get different battles. So people just need to get the vaccine that's available now that works as well as it can. And, you know, for example, the vaccine isn't 100% effective anyway, but it is very effective in stopping people from getting hospitalization or from dying from the disease. So it is, you know, it is good news about the fact that it looks more and more likely that transmission is affected by the vaccine. But we still do have to stick to the rules, because we can't be sure at the moment. And I think the other bit about, you know, just get vaccinated, don't wait for the perfect vaccine that stops transmission, stops deaths, works against every variant. That may never come.
We'll come on to all the follow-ons. I can see the others are all muted, so please feel free to unmute. Please join the conversation. I know Liz Walker's enjoying doing this from her garden as well. It must be quite chilly for you today. But anybody else want to add anything at all?
I agree with everything that that Ash has said. I think that why get vaccinated? I agree. I think I do not want to carry on living like this. I think there are elements of things that we've got used to, and that's brilliant. And I think there are some things that we will probably continue to do. So hopefully better hand hygiene, not going into work if you've got a stinking cold or the flu or something like that, you know, that you can work from home and you can do that effectively. Those sorts of things. So around infection control, I think will be really good. But I would rather not continue to live my life going in and out of various lockdowns. More than that, I would rather not live my life knowing that there are people dying from a horrible disease when we can prevent that. And I think that our generations that are living now have forgotten about that. The older generations remember the days of measles, mumps, rubella, smallpox, killing people, killing their friends. And we don't remember that because we've always had vaccination in our lives. to help prevent those horrible, horrible diseases. This is the first time that a bad disease has come along and caused death in our communities. And immunization, vaccination is our way out of this. And this is going to help us to return to, I won't say normal life because I think it will always be a little bit changed, but this is our chance to return to a new normality, a new way of living. Maybe things will be a little bit better in some respects. But this is the chance, this is the opportunity to do that. I think that's really important.
One of the arguments put to us before this conversation that we're having now is, I don't want the vaccination, happy to be tested, and if I get it, I will deal with it. Is testing itself not enough?
The problem with coronavirus is that we cannot predict how it's going to affect you. So if that strategy would be absolutely fine if you knew that you were going to be one of the ones who your smell was a bit affected for a couple of days, you might have a bit of a cough, bit of fever, feel absolutely shocking for a few days, but then you're fine. If you knew you were going to be one of those, then yes, fine. But there are a lot of people who wind up going into hospital. We've seen the pictures, everyone will have seen the pictures of the intensive care units being full of people being ventilated. What you won't have seen is the people who've also needed to go on to kidney dialysis, who perhaps have had strokes because of the clots, and I'm sure that clots will come up in other conversations shortly as well. You haven't seen the pictures of the patients with post-COVID, the people with post-COVID. This is an unknown group at the moment. We don't know what the longer term effects of this illness are on people. We're, as with everything with regards to COVID, we're finding things out all of the time. But the impact that all of these things have had on the individuals, on communities, on the health service is massive. It's huge. And so to say it's all right if I get it, I'll deal with it. Fine, but you don't know what you're going to be dealing with. You have no idea until it hits you. You might be lucky, but you might be really unlucky. And vaccination could help prevent that.
You mentioned clots. I'll come back to that in just a moment. But what, if anything, do you know about long COVID at this stage? We're only just about a year, well, just over a year into this now, aren't we?
Not an awful lot. There has been some guidance that's come out for us, but it seems that it's affecting the younger populations. So perhaps while the older populations or people with existing medical conditions might be more likely to be very poorly at the time, the younger people who may or may not have needed to go into hospital, so you don't even need to have gone into hospital to develop long COVID, can wind up with some debilitating long-term symptoms. So fatigue, maybe a chronic cough, maybe issues with your heart, with palpitations, all sorts of bits and things. We're seeing some long-term neurological symptoms as well. And we're trying to piece it all together and work out how to help these people to move forward and to be able to live their lives again. But there are some people who 12 months on are still really suffering the after effects of COVID.
I think Charlotte's completely hit the nail on the head there. It's the unpredictable nature of things, and that's what makes it a very difficult condition to manage. And coming back to the original question as to why have the vaccine, well, have the vaccine because it's going to drastically reduce the chances of you being in that situation, of being one of the unfortunate ones who is severely affected by the condition. And just to add on, I think it's just really kind of re-summarizing what other people have said. It's just all part of our way out of the situation that we're in now. We've got the vaccine, we've got social distancing, we've got hygiene, we've got test and trace, we've got all of these things. And as the case rate comes down, test and trace is going to be so much more effective as well. So it's all part of a group of kind of things that we've got together that's going to help us get our lives back to some kind of normality.
We've mentioned blood clots. Let's talk about blood clots. What are the risks around those? And a lot of it has been centered, according to the report, around AstraZeneca, hasn't it?
Yeah, well, so I start a little bit of that. So blood clots related to the vaccine. So these are very, very rare. Again, it's not predictable who will have a blood clot as a result of vaccination, the blood clots seem to be associated with the vaccines that are associated with a viral vector. So that's the AstraZeneca and the Johnson & Johnson vaccine, which we're not yet using in the UK anyway. So the Pfizer and Moderna, which are constructed in a different way, don't seem to have that problem associated with them. But I think it's like with all things, we have to put it into some kind of perspective. So it looks that overall, the chances of getting one of these serious blood clots in unusual places, these are the things that have kind of made the headlines, is about 4 in a million. So very, very rare in the global scheme of things. It's far more likely that you would get a blood clot related to COVID than you would ever get a blood clot related to the vaccination. And just to put things a bit more into perspective in terms of everyday life, taking the contraceptive pill, for example, it gives you a far higher chance of having a blood clot than having the vaccination. Now, I'm not suggesting that people don't take the pill, that we've seen that in the past, that the kind of problems that we had when that came up as an issue in 1996. Pregnancy itself is also a condition that greatly increases your chances of blood clot, particularly immediately after delivery. And it's far more likely in those situations than it ever would be with the vaccination. But we would never suggest to people, don't become pregnant, don't take the pill, etc., etc. So I think, as with all things, these are unusual situations. It's very, very rare, clearly devastating for people who it happens to, but it's unpredictable. And the kind of the opposite way around in terms of COVID itself, it seems to be younger people that are being affected by blood clots associated with the viral vector vaccines than older people. And that's why some of the advice has changed as more information regarding this has accumulated.
Now, Andrew, you mentioned Moderna, you mentioned Pfizer, and in relation to blood clots as one of the differences between those and AstraZeneca. Are there any other differences between the different vaccines?
Not really. I mean, ultimately, they're all trying to achieve the same thing. I mean, I guess one of our vaccine experts may be better to talk about that than I would, but essentially the vaccines are falling into two classes: those that use a viral vector to introduce the genetic material to generate the protein spikes that are going to be recognized by the immune system, and the other ones are using messenger RNA within a lipid particle to do the same thing. But maybe, Ashish, you'd like to talk. I think that's more your field than mine, so you might want to talk about that.
Thanks, Andrew. Yeah, I mean, the key thing really is that there's a range of vaccines now, and there's going to be more in the coming months. But the key thing is that they're all safe and effective. So they all work. They all stop you ending up in hospital or dying of COVID. They're all safe. When you see your doctor or you go to the vaccination centre, they'll go through some questions with you to make sure that you get the right vaccine. So most people can receive most of the vaccines, but you may have certain allergies, or you may have something else in your medical history. So it's more really just about tailoring it. We do say for the AstraZeneca one, because of the blood clots, that we don't give it to people generally who are under 30 or who are otherwise well. Because as we've said, clots are slightly commoner in those younger age groups, and therefore we would rather give Moderna or Pfizer. And similarly, again, we would give Moderna or Pfizer to pregnant women. So the thing that's in common with all of them is they all work very well. They're all safe, but just depending on your age and why you're there and your past medical history, we may choose one or the other. But most people can have all of the vaccines or any of the vaccines.
Now, on that, one of the questions that came in recently is from a gentleman who works in children's services social care and whose wife works in the NHS. My wife is pregnant, he says, and following recent JCVI advice, recommended that she has the vaccine in line with her priority group. As a frontline NHS worker, that is now, but as the guidance recommends that she's not given the AstraZeneca vaccine, a booking has not been possible. They've tried occupational health, they've tried 119, the GP, the local vaccine helpline, and they've tried calling the vaccination centres directly with no progress on being able to get an appointment for that first vaccine that is not AstraZeneca. They're saying it seems to be near impossible to be able to make such a booking. So how can they and anybody else that has to avoid AstraZeneca, such as the under 30s and those with pre-existing conditions, how is that going to be possible?
Shall I take that one, Chris?
Yes, please do, yeah.
So you are quite right, at this precise moment in time, it's very difficult to identify through the national booking system if you need to go into those categories. Nationally, the national booking system is changing the algorithm to support that, but it's going to take a little bit of time to do that. The other side to this is GPs are able, through their networks, are able to offer those vaccines, but it goes back to what Ash was saying, it's about that clinical conversation. It is critical to ensure that if you are under 30 or if you are pregnant, that we do filter you to the right place. What we've also noted is that if you are pregnant, we are trying to do what we call a specialised clinic, where we can bring those individuals into that one clinic to offer them the correct vaccine. That's going to take us a little bit of time to set up. It's probably about 2 to 3 weeks to set up. And that's purely because we need to make sure we get the right vaccine in the right place. So in the next coming weeks, there will be some more information coming out, and I'll take the email that came through from that individual and I'll work with them, and hopefully they'll be able to help us as part of that process.
And so anybody else in a similar situation, is it just a case of hanging fire for 2 or 3 weeks?
Yes, it's a national thing. So you know that we don't advertise where the vaccines are, and that's purposely done because we need to ensure that we know where things are moving to. But what we do have the ability to is filter people through. It's another step we need to put into the process to do that, to make sure that works.
Can people choose which vaccine they want, or is it a case of the right one will be chosen for them?
Yes, Charlotte, do you want to do that?
Yeah.
Charlotte was nodding, yes.
Yeah, absolutely. Yes, absolutely. Because we have because the supplies are given to us. So I, as the clinical director for my network, I don't get to choose what vaccine I get and how much, because we need to be careful. This is a huge national effort, and so this is being managed at a much higher level so that we can make sure that every area has equality of access to the vaccine. So that's really important. But what that means is that you might have some weeks where you've got one vaccine, some weeks where you've got another one. So unfortunately, unless there's a really good clinical reason for you to have a specific vaccine, you don't get to choose. So you might think, oh, I really don't want to have AstraZeneca, or I really don't want to have Pfizer in the beginning, to be fair. You don't get a choice. So we will offer you the vaccine that we have on that day. If there is a good clinical reason why you should be having an alternative vaccine, so for example, if you are pregnant, then we will do what we can to make sure that you get Pfizer. The question that Angie answered about the lady who's pregnant, it sounds like you guys have done everything absolutely right in asking the right questions of the right people. I would urge anyone who's in a similar situation to this couple to make sure they do have a conversation with the GP, because depending on the area, there may be a little bit of Pfizer that's available in that local area. And it's only the GPs who will know that and who might be able to signpost you to that. We have a little bit that we're able to use for our 16, 17-year-olds and our pregnant ladies each week. But that will be for a limited amount of time. So it all depends on where your network is in the time scale of everything. It's not that we're being difficult or trying to withhold anything. It's just simply we're trying to work with what we've got and find the right solutions for everybody.
I was just going to say as well, it's good to get your second dose within 12 weeks of your first dose, but nothing actually magical happens after 12 weeks. So it's not 12 weeks and a day you're not protected and the day before you were. And after 12 weeks you are less protected day to day. So it's important to get it done, as soon as you can. But you still do have some protection, and you won't have to repeat that dose. So you never have to have a third dose because there was a delay as well. So it's important to get done, quickly, but your protection doesn't just drop off after 12 weeks straight away.
There has, however, been coverage this week talking about third doses, and possibly that's going to be Pfizer for everybody, potentially, maybe in the autumn. What do we know, if anything?
So I think
not a lot, I don't think, is it?
No.
Other than
Yeah,
what's reported in the news.
What we've seen on the news, yeah.
There's
So
a selection of potential vaccines, isn't there, for the autumn? But I don't think we know yet which one we're going to be going with, if any.
We've talked about people who are therefore given the appropriate vaccine for their circumstances, but is there anybody who can't have it at all, any of them?
Yes, there are. If you have had an anaphylactic reaction, so that's not, you know, a rash or a normal local allergy, but kind of a life-threatening allergic reaction to the first dose of the vaccine or to one of the constituents of the vaccine, or perhaps you've got an allergy to a condition but you're not sure, you know, what you're allergic to. You've got something we call idiopathic hypersensitivity, or you're allergic to multiple drugs. So sometimes you've got these allergies where it's not clear. You may need to go and see an allergy specialist. So those are those kind of conditions. And then we've already talked about pregnancy and age. And then the other main thing is probably around, no, actually, I think those would be the main kinds of things. So we look at your pregnancy, age, we look at history of allergies, and there's some very rare things in AZ. So there's a condition called heparin-induced thrombocytopenia, which is if you've had heparin in the past, some people, when they've received heparin, get blood clots and low platelets, which is very similar to the mechanism what happens in the clotting problems in AZ. So if you have something like that, you can't have it. But basically, nearly everyone can have most of the vaccines.
And will they?
Sorry,
Angie, go on.
For a lot of the contraindication things that Ashley's just mentioned, a lot of them will only apply to one or other of the vaccines. So if you've had an allergic reaction to one of the vaccines, you can still potentially have a second dose with an alternative. And if you've got a history of complex allergies, it doesn't necessarily mean you can't have a vaccine at all. It doesn't mean you might need to have a vaccine in a specialised setting. So if you're at all concerned, I'd just say go and talk to your doctor if you've got a complex history of allergies or any previous reactions to heparin, because it doesn't stop you having any of the vaccines. It's just certain ones then.
Will the vaccines protect, one of the questions that's come in, me from mutations? And this, I guess, is possibly what we spoke about just a few moments ago, the possibility of a third jab, maybe in the autumn. There's even been talk about this becoming an annual event.
It's unlikely that a variant will make a vaccine totally ineffective. What it might do is make a vaccine slightly less effective. So what we do think is for the main variants that are in the UK at the moment, in terms of pure numbers, so in terms of the variant that you're likely to catch, that all of our vaccines are effective in stopping severe disease. So it may not stop you getting kind of mild disease, but it should stop you getting severe disease or hospitalization or death. There are certain variants that we're more concerned about because, and this is really an emerging issue, so we don't know yet whether, you know, some of these newer variants will not work as well again with the vaccines. But because of these are new technologies that we're using in vaccine manufacture, the idea of using RNA and DNA and genetic codes to produce vaccines means that we can actually change the nature of those vaccines relatively quickly. So that's the idea really behind the boosters and the things. I mean, there's two things. One is that you might want to boost people if that vaccination they've had is waning. And the other bit is you might want another dose again, which covers you better against new variants. And those are the kind of things that they're looking at nationally at the moment.
And that all still to be advised as time goes on, I guess.
Yes.
Very much a moving feast, isn't it? We talked about blood clots. Let's just rattle off through the other side effect questions that have come our way. What are the side effects of the vaccines collectively, both shorter term and longer term?
Shall I take that, just because I've seen an awful lot of people who've been coming through for their second doses, so I can tell you what they've been experiencing after their first doses. The commonest side effect that we've seen is soreness around the injection site. So a bit of a sore arm, might feel a little bit heavy for a day or two. And that is by far the commonest side effect. And the majority of people who I've seen who've been attending for their second dose have gone, that was it. I had nothing else after my first dose, just a slightly sore arm.
So hardly anything surprising then, really.
Hardly anything at all, which is brilliant. Some people have felt, this is a very technical term, a bit ropey. for 24, 48 hours after their first jab. So maybe a bit of a headache, bit achy, just not quite right. A couple of people have gone, I just lay on the sofa for the day and drank lots of fluids and had some paracetamol. And I woke up on the second or third day and felt absolutely fine. So that's pretty much what we're seeing with the vast majority for first dose. The people who I've spoken to who've had their second dose, and this is anecdotal because it's from, patients, friends, colleagues, who I've seen, again, pretty similar. Most people absolutely fine, maybe a day or two of feeling a little bit ropey, maybe slightly worse with the second one, but not always. So what I'm saying to patients when I'm seeing them for their second dose is, look, how did you get on with the first dose? From the point of view of the side effects that you're going to get from your second dose, it might be the same, it might be worse, it might be better. It's a lottery. We'll know in 48 hours. But actually, generally speaking, it's been okay for the majority of people. Long-term side effects, I haven't seen any reported. It's something that's being monitored very carefully. So we have a very robust reporting system in the UK for any side effects that could be attributed to the vaccine. There will also be lots of studies going on looking at, do we see any spikes in particular conditions? That's how the whole thing with the blood clots got picked up. What we've got to remember, though, is we are vaccinating a huge amount of the population, more than we have ever done for anything ever before. And in the background, normal health things are still happening. So normal things like heart attacks, like strokes, like blood clots, like stomach ulcers are still happening. What we won't know for a little while yet is whether any of those have got worse because of the vaccine or just because they would have done anyway. So we're monitoring all of that. These things are being picked up on, as has been demonstrated, with the potential risk, and I stress that potential risk with regards to blood clots. So we're going to, it's a moving feast. We've had that for the last 12 months, right? That we're learning things all the time. What we thought at first, some things shifted and changed, and that's going on all the time with regards to the vaccination campaign as well.
And when you talk about long term, I mean, we're only a few months, really, aren't we, into the whole thing's only been just over a year. But what is long term? What would you class as long term if you're looking at long term effects or side effects or long term anything?
It would be an effect that stays with you for more than 12 months. Now, the first person to be vaccinated, well, the first person hadn't been vaccinated 12 months ago. Yeah. I think it was it May or June they managed to get the first vaccines into trial. It was remarkably quick. So we're not even quite at that 12-month stage yet. As far as we're aware, there's nothing that we're being warned about to look out for at the moment, but it's something that's being monitored carefully and closely so that if there is anything that crops up, that we can be made aware of it, but nothing so far, which is great.
For those with different diseases, for example, hypertension, heart disease, asthma, or cancer, what testing has there been in relation to safety and efficacy?
I will be very honest with you, not a huge amount. So the trials were on people who didn't have those conditions. We will be learning more about people with those conditions from the vaccination campaign now. So we'll be getting real life data from the people who have come forward to have their vaccine. There's some data from previous similar vaccines. So, for example, with the Pfizer vaccine, they used that for Ebola and Zika, and there's no long-term side effects that have come through from that. So the same technology that's being used to get the vaccine, get the body to mount the immune response, that was used in those two vaccines as well. And there's been nothing long-term been reported with those. So for anyone with any specific healthcare conditions at all. But again, this is all stuff that we're going to be watching and monitoring very carefully. So the Medicines Regulation Agency in the UK and in Europe and worldwide, they're all going to be looking at all of this and sharing information that may be coming through.
Given everything that we're discussing here, the advice that you're giving, one of the questions that we've been asked, which I will extrapolate a little further, given the audience that we're talking to being people working in health and social care. The question was, can I refuse the vaccine? But specifically in the context of social care, can a social care worker refuse the vaccine? And if they do refuse it, what are the consequences?
So I don't think we know the answer to that as a group. I think the response is, at the moment, vaccines are voluntary. However, there is a consultation going on nationally for the care sector fraternity, where care sectors are being asked, should it be compulsory? Should it be mandatory? We need to wait for the outcome of that consultation to understand it. And I liken it to other health vaccine campaigns, that as a healthcare provider, you would have your hepatitis B vaccine or your C vaccine potentially if you're in a risk situation. I see that similarly for this vaccine. It does give you such a level of protection for you and your patients that you're caring for. So I personally, and this is not a system view or a national view, but I personally would encourage you to have the vaccine, and I would like to see it at some point in the future as part of a health worker's requirement. But that's my view, and only because of what I've seen, the benefits of this programme and of the vaccine to the people that we are caring for. I'm sure everybody else has got a similar view or a view.
Any others before I move on to a supplementary question? Supplementary question that for someone who decided not to take up the offer of a vaccine, compulsory or otherwise, but they decided not to take up the offer of the vaccine when invited to do so, can they change their mind? Can they have it? And if so, how do they go about doing it?
Yes.
And how?
Yes, they can. So for those of you that didn't take up the vaccine the first time, there are a couple of routes open to you. The national booking system is one of those. You have to self-declare that you are a health and social care worker and prove that you come in, that you've got the fact that you are in that field. You can contact your GP. You might find that somebody might ring you anyway, because what we are doing is anybody that's in cohort 1 to 9, we are going round the loop again, ringing them, contacting them and offering them a vaccine appointment. So the answer is yes. And
the way to book is to go to the national NHS website, which is www.nhs.uk. Nice and short, www.nhs.uk. A couple of yes/no questions. We'll rattle through these two. Are there any animal ingredients in the vaccines?
No.
Is there any alcohol in the vaccines?
There's a very small amount of alcohol in the AstraZeneca vaccine, but it's kind of the rate you would find in bread or a ripe banana. So it's, trace, minimal amount.
And so what else is in them?
they will contain, I don't know, Liz might be better placed than me, actually.
Yeah, no, yeah, there's a list of ingredients in there, and if I name them, it probably wouldn't mean anything to anybody because they've all got very long chemical names.
And
but
we've
there
only
is
got
nothing
12
in
minutes
these
left
vaccines.
anyway. So.
Yeah, there's nothing in any of these vaccines that you wouldn't find in a normal vaccine that people have routinely. So flu vaccines, they've all got the same sort of background ingredients in them. And obviously, as Ashley mentioned, there's a few that we know can cause allergic reactions, so we wouldn't be giving the vaccine to people who've had an allergic reaction to something that contains the same ingredients, but there's nothing that people should be particularly worried about at all.
We have a list of questions in relation to pregnancy. We've already touched upon pregnancy earlier on. Can pregnant women have the vaccine?
Yes, they can.
Should women who are planning to have children have the vaccine?
Yes, they should.
If I have the first vaccine and then find out I am pregnant, should I put off having the second vaccine?
No, you shouldn't. I mean, I think the current advice that people are saying is if it was in very early pregnancy, for example, that you would possibly do your second dose, you might want to consider delaying it until after 12 weeks. And that's in the national advice at this moment in time. But there's no hard and fast reason to do that. But I think one of the things we always have to think about, particularly in early pregnancy, is that miscarriage is always a risk in early pregnancy anyway, whether you're having a vaccination or you're not. And I think for a lot of people, if they had possibly the second dose and then went on to very sadly have a miscarriage, they may ascribe it to the vaccine, although there's no evidence that that's the case at all. And there's certain times in pregnancy where miscarriage is more common, and that tends to be in the early part of pregnancy. Plus, the early part of pregnancy is when main development is taking place. So there's no hard and fast reason not to have the second dose at that time. But many people might want to consider, if they'd just had the first dose before finding that they were pregnant, that they may wish to delay it until after 12 weeks of pregnancy.
If I am currently pregnant, should I be shielding from 28 weeks?
No, the only people that need to shield are the ones on the government shielding list. So that if you're pregnant and also have a condition where you're on the shielding list, then yes. But I mean, as pregnant women beyond 28 weeks would be ascribed moderate risk at this moment in time. So it's therefore important that they adhere to the other things that we've already been talking about: social distancing, good hand hygiene, avoiding situations where they might put themselves in risk. But no, pregnancy itself, unless you've got a coexisting heart problem, isn't a reason to shield at this moment in time, particularly at the moment when the case rate is so low.
And should women who are breastfeeding have the vaccine?
Definitely yes. There's no mechanism whatsoever that the vaccine could pass in breast milk to a baby, but actually women who are vaccinated, as we know, will make antibodies. Breast milk contains antibodies in quite high concentrations, and they will be protective to the baby. So yes, definitely women who are breastfeeding should have the vaccine.
Wrapping up now, will the vaccine give me COVID-19? Shaking heads. Shaking heads.
No, it hasn't got
that's a no.
None of the vaccines have got any live virus in them. So there's no mechanism by which they can induce COVID-19 infection in you. You might feel, as I said earlier, a bit ropey because your body is mounting an immune response, and that's a good sign. So the temperature, maybe a little bit of a temperature, a bit of a headache, a bit of achiness, is your body mounting the immune response and starting to produce antibodies. So that's okay, but that is not COVID, and you are not infectious because you don't have an infection because it hasn't caused COVID.
Is it a case of no pain, no gain, as some people might possibly say?
I mean, I'm probably a bit of an optimist, but I always say, well, if you're having some symptoms after your vaccination, that's a good thing because your body's responding to it. So celebrate it rather than feel like a limp lettuce leaf.
Yeah, that is true. But on the other side, some people worry that they don't have symptoms, the vaccine hasn't worked, or because sometimes the actual administration is so smooth, people don't even believe that they've had the jab, so then they don't get any reaction. But so even if you don't have a painful arm or feel that unwell, it still is working as well. So don't worry.
For someone who's had COVID already, do they still need to be vaccinated?
Yes.
Yes.
Does your DNA change when you've had the vaccination?
No.
No.
Are we straying into conspiracy theories here?
Yes,
We are. Yes. There is no DNA in that vaccine, and there is no way it can possibly have any impact on your DNA or your genetic makeup at all.
And then after the vaccination, first, I guess actually after the second, what do I need to do?
Maintain your social distancing, comply with all the rest of the government advice at this time, i.e. hand washing and wearing the masks as we go. And I think you've heard on the news quite a lot, we are still not out of this. We're not out of the woods yet. We have all got to do our part. Vaccination is one part of that. The other part is testing. So making sure you, if you need to, continue with your testing programs in your places of work. We can do it, but we all need to do it together. So I'd just like to reiterate to everybody saying, come for your second dose if you hadn't had your second dose. Make sure you've come for your first dose if you haven't had one at all. But we all need to move forward. And it goes back to your original question, Chris, of why have the vaccine? because we all want to get back to some kind of normality, don't we? So it is really important that we do that.
And I think that's really important, particularly as we continue to slowly unlock some things. It was lovely. It's been lovely over the last couple of weeks to see people able to go out and enjoy seeing friends and, you know, have meals and so on and everything outside. That's absolutely wonderful. But I would like to remind everyone, we're not back to normal yet. This is not normal. So we still need to make sure, as Angie said, we still need to do the social distancing, the masks, the hand hygiene, the testing, the vaccination. Don't be lulled into a false sense of security yet that that it's all okay and you can go and give your best mate a hug. We're not there yet. We're on our way to it now, which we weren't for a very long time. We were static. We are on our way to it now, but we're not there yet.
So you know what you need to do, you know what the end game is, and you know what there is to look forward to. Thank you for joining us. From Charlotte Hart, Liz Walker, Ashley Banerjee, Andrew Sizer, Angie Wallace, and from me, Chris Kowalik. Goodbye.
Bye.